Hello, my name is Professor Patrick Treacy and I'm speaking to you from Dublin. I made up some lectures for the Ethiopian Society of Dermatology, and the first one that we would look at is microneedling radiofrequency. And we introduced microneedling a long time back when I worked in Australia, probably as long back as 1998, 99. And then introduced it to Dublin probably around 2001, 2002 as Derma Roller. We have much better devices now, of course, with a lot of things like Derma Pen. And also we have, of course, the introduction of radiofrequency. We ran the trials in Dublin in 2004 with Syneron, and they've come together now as microneedling radiofrequency. So as a consequence of that, I am going to show you one of our devices that we use in Dublin called the Onyx. So this is microneedling radiofrequency, both, I suppose, parameters brought together. And as a consequence, we now have golden electrodes that go down into the skin, protected at the upper end with plastic sheets to not allow the epidermis to be targeted. And as a consequence, the needles pass radiofrequency through the dermis, where it's able to wound healing and new collagen formation and elastin. So let's look at the first lecture, which is microneedling radiofrequency. New to the marketplace, we're doing the clinical trials at the moment, and I suppose there have been similar type devices, which is a mixed RF microneedling method to induce new collagen, but this actually runs at a slightly higher platform. Some of the devices have been running 1 to 5, this runs up to 10. Probably the lower levels 1, 2 and 3 could be used by more junior levels of staff, your senior nurses, probably 4 and 5 and above that, probably a doctor. As you know, microneedling has been around quite a long time. Started probably related to this Swiss-French dermatologist, and we have to take into account many other people. Des Fernandez, certainly in Cape Town, was doing it, I remember, in the 90s. I was doing it myself in Australia a little bit. We were using different type of devices, more like rubber stamps at the time. And this, I suppose, has changed over the years, particularly with devices like derma pens, motorized needles, and they have benefits and, I suppose, faults like everything else. If you want to chop up the skin, the little wheels still, I suppose, have to an extent. If you want to chase individual scars, atrophic acne scars, it's obviously ice pick isn't the best, or even varicella scars, then these motorized pens are quite efficient. If you're going to get one, obviously get one that can be cleansed. There has been instances of people being sued for HIV. Now, what's different about Onyx to an extent is that it uses different RF frequencies, so a bit like radiosurgery, using your coag and your cutting heads and all the rest, the machine itself, I'll go into it later, gives different patterns in 0.5 megahertz, 1 megahertz, and 2. It's got a dwell time of quite a long time, 7 seconds, and its penetration runs from 0.5 to 6 millimeters. So if we're doing cheeks, we're probably still around 2.5 to 3, forehead probably 1.5, and you know yourself, we're moving into tightening jawlines and using it for different parameters. It's got a TEC cooling plate, the only system to have that, and it's got additional LED functions with it as well. Now, it's got a very intuitive screen. You can see that there's 4 parameters on it. The top left one is the strength of the RF, runs between 1 and 10. Then the depth of the needle, probably running a little high there at 4. Most of them would run at 2.5. The level itself can be changed all the way up to 10, and the RF time is a bit like dwell time on a laser. You can change the parameter there. This is the handpiece. It's got non-insulated gold-coated electrodes, and it's got a hand switch, a foot switch, and an automatic level as well. So you can set the parameters, particularly the depth of the needle and all the other 4 system parameters on the intuitive screen itself. You can see the advantages of gold-colored coated needles in terms of they don't tend to erode, and it has a low possibility of causing allergic type problems. Skin is compatible with it. This is just some histology of insulated, non-insulated microneedles, and you can see the zone of thermal necrosis is changed between them, and it is certainly more direct and efficient with the onyx insulated needle. This tech cooling plate has been patented for this machine also. It can come off quite easily and go into your autoclave, and it's activated by thermal electric filter. And filter devices, actually they were invented down the road here in the 1890s. Filter was a Parisian scientist, and it really is, if you have 2 different metals and you pass an electric current through them, you'll get a heating effect on one side and the other that you can reverse also. If you actually heat them up, you can get electric current the other way around. That's called the sealing effect. And this is used as a consistent means of cooling. This is what I mentioned earlier, that if you use the different 3 RF modes, if you use 0.5, which is the lowest, it's wide and deep, as you can see from this, all the way up to 2, which is narrow and more concentrated. It also uses a special circuit board called a chevron circuit board to give better RF emission, flow, and effective treatments. It's up and running already with CE marks for acne scarring. A lot of the trials have been done in the East, particularly Korea, and we are presently putting it underway for jawline and neck tightening with some effect. It seems to be also that it can be used for hyperhidrosis. I haven't used it for that means or method just as yet, but that does seem to be a very interesting aspect to it, particularly axillary hyperhidrosis. These are the contraindications: people with tumours, people who are pregnant, people with severe cardiovascular or cerebral vascular disease, people with pacemakers or defibs on board, like most RF devices. This is up to the doctor if they want to sort of, these aren't contraindications, but there's something to be aware of. People who are on blood thinner medicine, people who have a history of keloid scarring. I don't think I would be treating somebody with that. Obviously, again, hemophilia, eczema, people who are suffering from just straightforward dermatological diseases like rosacea, maybe people who have got tattoos. And you can get these little marks afterwards. It's almost like a scab type effect that lasts for 2 or 3 days. And you can get this sort of track mark down below, that histamine reaction lasting for a few days as well. But most people would be possibly red overnight, and that would be it. You'll get a little bit of bleeding, the same as you would with microneedling. It's a bit less, obviously, because there's a coagulation effect from the RF itself. You'll get some erythema that can last for some hours or maybe overnight. The patient themselves could get a reaction where they feel a bit of pain, so you have to watch it as you go along. You use a local anaesthetic for hands, face, and neck, and the sensation has been likened mostly to skin burn, or sorry, just like sunburn. Some people, as you say, get these histamine responses, and I think we're almost ready to run. Rory, are you ready to? Now, the different levels that we can do are, as I said, depth, pulse duration, and frequency can be set, and the RF levels. Have we got a connection with the live demo? It's just if I keep talking, then I'll be able to do the live demo.
Yeah, he started.
I cannot hear you, Del. Oh, you are.
So that patient would have a local anaesthetic on beforehand. I myself tend to use stronger anaesthetics, almost, I think they're just using Emily here, which is 5%. I tend to use 20 to 25 because I tend to use those in laser resurfacing anyway. Or we make up our own BLT or lipophilic lidocaine. You can also do multiple passes. So this would be a first pass. Can you hear me, Rory? What sort of settings are you using at the moment? We can't hear anything. Maybe, oh, you can see the machine. Okay. Right. Okay, so it's level 3, and the delay 0.5, depth is 2. So these are fairly moderate settings, and I suppose for a live demonstration, if we don't want anything to go wrong, that's fine. Usually we leave a period of about a month or 40 days between each treatment. And I suppose different clinics charge different things. We charge about €400 a treatment. And particularly I want to see the effects of the study on necks and jawline.
A little bit amazed, Patrick, that you are not using insulated needles. It seems to me like being a little bit old-fashioned.
Those needles are insulated.
Oh, those needles are insulated?
I think so, yeah.
Oh, I thought you said. So the only effect will be deep down on the tip.
I think actually I have it on the thing, but the R, yeah. There's just a little tip at the bottom that's exposed. Yeah. Which is the reason, I suppose, in that histology slide, you could just see the thermal necrosis in the dermis itself.
Also use it to get some drugs in or cosmeceuticals?
Not as yet, but I know that we have discussed that in the past, not you and I particularly, but at some of the meetings in terms of transdermal. I do it all the time with ordinary microneedling. I suppose I'd be almost afraid to do it in this in case it damaged the heads. The heads are obviously changed between every patient, but particularly a lot of the hyaluronic acid serums, I don't know whether if it got back up it would block maybe the little motor or something. And when the device belongs to somebody else, you're always on the side of caution.
Any darker skin? Have you used it on it?
Yes.
Yeah.
Yeah, it's
No problems.
no, it's blind. And you can also use it for hyperpigmentation, the same as you can with microneedling to an extent. Its use in axillary hyperhidrosis is going to be of interest, you know. And the fact that other devices like Miradry can't be used in the hand per se, it'll be interesting to see whether if it is effective, because it is a less invasive, I suppose, method.
Immediate post-care?
Yes, we have a type of moisturizer we give the patient afterwards, and we have a post-treatment sheet.
Are there any questions from the audience? Do put them across for each device as we go along, please.
That little black thing you can see at the side is the cooling tip, and it comes off after each patient and gets sterilized. And you can see the machine now is at level 3, isn't it? And the patient still isn't feeling particularly too much pain. In fact, she looks like she's asleep.
It's quite comfortable.
Yes.